what is the fundamental difference between homeopathy and allopathy?
Homeopathy is basically like cures like, a science with no side effects. We take mental symptoms as well.
Are there any conditions where homeopathy is not recommended?
60 to 70% of our cases are chronic. Psoriasis, eczema, asthma, bronchitis, gut issues, IBS.
Hello and welcome to India TV. I am Shivangi and you are watching HealthDNA. Well, you must have heard about homeopathy because it is one of the most widely used systems of medicines today. But it is also the most debated one because people have questions about the science behind it, how it works, and also how effective it is in comparison to allopathy. So to answer all that, we have with us Dr. Tanya Bakshi, the MD from Bakson Homeopathy. Ma'am, welcome to India TV.
Thank you.
And first of all, as I said, people compare homeopathy with allopathy. So I would like you to answer and tell us about how homeopathy actually works and what is the fundamental difference between homeopathy and allopathy.
Homeopathy works on the basis of law of similia. This is the basic law of homeopathy. Homeopathy is basically like cures like. That means I as a homeopathy doctor will prescribe you a medicine which will be matching the symptoms of your disease. So if you have a throbbing headache with redness, I will match the symptoms and take that exact medicine out. This is the basic fundamental with which every homeopathy doctor in the country today practices. Every homeopathy doctor. These are our basic principles in homeopathy that make homeopathy a science that is trusted in today's time and a science with no side effects.
Yeah.
Because homeopathy the best thing is that it is a very, very trusted science. Very trusted science because any medicine you give in the right quantity will have no side effects. The right homeopathy medicines will have no side effects. So, हम body को torture नहीं कर रहे हैं, हम body को सही तरीके से treat कर रहे हैं in reality.
Okay. Also, as you said, torture. When I talk about conventional medicine, I get tortured from the medicines, the tablets and the capsules that they give. But one thing that I like about homeopathy is the medicine. Those tiny sugary pills that we have to ingest, I can swallow them very easily. But also I would like to know how do you prepare them and why are these so much diluted? Why is that thing in homeopathy?
In homeopathy, we have something known as ultra-high dilutions. Yeah. These ultra-high dilutions are basically potency-making dilutions that you see. So basically, ये dilutions जो करी जाती हैं, they're done to make sure that we have high potencies. So supposedly, we have 1 m, we have 200, we have 30 written on top of the medicine. Yeah. Why? Those are potencies. Those are potencies that further indicate how strong the medicine is. So certain times in homeopathy, people question, why is there 1 m here and 30 here and 200 here and which one should I give? In reality, there is a range of how strong the medicine is. One is 200 or 30 and then you have 1 m, which is a very, very strong medicine. You also have other scales across aage jaake, but one thing is for sure, every homeopathy medicine, when it is raised in its potency, it becomes stronger. And those stronger medicines can heal certain conditions faster. That is why this range is created, predominantly in our factories with good homeopathy practices. Furthermore, when we talk about these ultra-high dilutions and how do they work, because people question, as you just said, are we just diluting it? Yeah, exactly. Is there any original matter left in it? So what happens is when you dilute every single time, so you're taking one part of your original substance, suppose you take a plant, okay, and you're taking 99 of a solution or dissolving agent. In our case in homeopathy, we have ENA, which is used. And then you dilute it further with one part of this 99. Then you take one part of this particular liquid and you take 99 another. It's a whole process. But what that does is, it gives you very less or negligible quantity of the original material. But it gives you all kinds of therapeutic indices of that particular plant that help heal the patient. Every single time. Imagine, are you telling me, but how do you know this?
Yeah.
How do you calculate this in your lab?
Yeah, exactly.
Or how do you even know this in your factory? There is something known as Avogadro's constant, beyond which there is no scale that can develop or see what is there in the solution. Beyond Avogadro's constant exists homeopathy. Okay. which is also influenced by nanodynamics, which state that above Avogadro's constant, we're dealing with nanoparticles. These nanoparticles mix with certain biological schemes in our body and heal the disease. Otherwise, these dilutions would have never worked. Otherwise, homeopathy would have never worked if there was no science behind it. But there is a very, very important futuristic science behind it. Because let's not forget, we were quoted by Albert Einstein, and he said this beautiful quote. He said, the future of medicine is energy medicine, is medicines that have an influence of energy in them. And that's exactly where homeopathy exists. That is homeopathy.
Energy medicine, as you said.
Alternative form of energy medicine, but not exactly. I think that it'll take a lot of time for people to come to this term. But 100% it's influenced by nanodynamics, which nobody talks about. Because nobody talks about how it works, but it does work through this. There are so many researches. Type nanodynamics and homeopathy together, you'll see a lot of researches on the internet today. Actually help
They have a proper process, they have a proper science behind it. Right.
And a whole proper HPI, homeopathy pharmacopoeia, is very, very big. It tells you how to process and make every single herb. Countries have HPI, have homeopathy pharmacopoeia. There's a HP US, there's HP UK. So all countries have different forms of pharmacopoeias. And this has not existed from now, right? It's existed from eons. 1800s was when the first evidence of homeopathy came about.
Okay.
So it's definitely more than 100 years, yeah.
Yeah, so obviously there's a lot of things at the back that we do not know. But of course, one thing also that I'm very curious about is the diagnosis. How do you guys diagnose a disease as compared to allopathy? Because people have this, comparison is always going on. So how do you diagnose a disease or a symptom in a person?
When you talk about diagnosis is very, very important in homeopathy, but there's a little difference.
Yeah.
We take mental symptoms as well. So if you come to me with a headache, I will often ask you what happened in the last 7 days. Was there any incident that happened in your life? Was there any dramatic incident that made you suffer mentally, or was there any accident in your family that you were worried about? Did you sleep enough? These are parameters I will ask. We believe that we can take mental symptoms and physical symptoms and then call it complete health. Because आज भी अगर आप definition of health देखेंगे जो WHO ने दी गई है, उसमें mental and physical health दोनों का reference है. So that is how homeopathy comes about. And जब आप diagnosis की बात करते हैं, अभी अगर आप कोई भी डिजीज़ डायग्नोज करना चाहते हैं, आप थायराइड डायग्नोज करना चाहते हैं, तो कोई भी डॉक्टर जिसको एजुकेशन है प्रैक्टिस ऑफ मेडिसिन की, वो इमीडिएटली थायराइड का टेस्ट कराएगा. राइट इमीडिएटली ब्लड टेस्ट कराएगा. ऐसे कितने लोग हैं जो आते हैं हेयर फॉल के लिए, मैं पहले उनको ब्लड टेस्ट का पैनल देती हूँ और बोलती हूँ सबसे पहले आप ये ब्लड टेस्ट कराएं हेयर फॉल के लिए. वाई? बिकॉज एज अ होम्योपैथ ऑल्सो इट्स इंपॉर्टेंट फॉर मी टू नो कि आजकल की डेफिशिएंसीज कितनी बढ़ गई हैं, आजकल की इश्यूज कितने बढ़ गए हैं, जो थोड़ा थोड़ा अभी करके आपको हेयर फॉल में या हेयर ग्रोथ में इम्पैक्ट कर सकते हैं. सो येस, इन डायग्नोसिस आज के टाइम पे ब्लड टेस्ट भी होते हैं एंड होम्योपैथ्स रेफर देम. आजकल के टाइम पे मेंटल एंड फिजिकल सिम्टम्स भी देखे जाते हैं द्वारा.
Yeah, exactly. When I was also being consulted by a homeopath as well, what was, something that I was very much surprised from was the fact that I was asked about my, my mood swings, my habits, like do I like to eat hot food or cold, do I like drinking water or not. So all of that also came into my consultation. I was like, why is she asking me all that? I mean, I was like so confused. Is she asking this for herself or for what? But now I can understand what's the reason behind this. There's a whole holistic approach, right?
Right, but also, not every case you can ask these details.
Okay.
Not every case I can ask, like you said, thirst and stuff. There's an emergency case of a child coming with cold. Today I will immediately give the child B22.
Okay.
The child cannot breathe congested. I will immediately give that because I know therapeutically that 100% works. So let me also educate you. Homeopaths across the country practice very, very differently.
Okay.
And that is completely normal. No two homeopaths will give a same medicine for a disease.
Yeah.
But it's important for us to know all the aspects of your health. So I can understand what happened mentally that influenced your headache.
Yeah, exactly.
Or simply that doctor who asked you, are you having enough water? So these are small things. So the minuteness and the detailing of homeopathy is what makes it homeopathy.
So is it also related to remedy? I mean, how is a remedy selected for a patient?
I think remedy selection varies from case to case. You can't say that it is going to be the same for everybody. But in certain cases, we've seen therapeutically, if a child has cold and cough, so many mothers give B22, B33 to the children and they're okay. So they're all the same medicines. They act.
So does it also happen that two people who might have the same conditions, they are given two different kind of remedies or treatments?
Kind of, yes. If they exhibit completely different symptoms, and completely depends on how the homeopath is practicing. Completely on that. If there are two patients who have cold cough and are taking B22, B33 same medicine from the local chemist, both of them are getting better. But if I have a case of migraine in my clinic and I have another case of migraine in my clinic where both are influenced by two different things, of course the medicine will be different, 100%. It's what your disease is influenced from, what are your mental causes. Everything that happens physically happens mentally first. Just remember that. A child with acne will often be a child who's been criticized a lot in life. Think about that.
This is a new aspect.
Yeah, you'll always
completely
see it.
different angle in
Imagine
health.
skin cases erupt most during separation times.
Okay.
Yeah, usually you'll see these small attributes. We see it as homeopaths in everyday life, right? So when we see it as homeopaths in everyday life, we can actually see how impactful they are or how minute they are. Like yesterday I had a case. She was pre-diabetic, she came to me. I said, what is stressing you out? She said, doctor, why are you asking me this question? What is stressing me out? You yourself asking me is stressing me out.
Yeah.
I said, but you have to answer me. What is stressing you out? Are you sleeping well? She's like, sometimes, but there's something stressing me out. My grandson is diabetic type 1. So it's stressing me out. She started crying, thinking about her grandson so much that it is influencing her daily life.
Okay, that overthinking is affecting her.
Exactly. And that is causing her stress, and that further is causing her inflammation, and that further is giving her diabetic values are going berserk.
Yeah.
So this is what I had to see. That what was the trigger for her?
And how do you bring that into the treatment process?
I, of course, indicate medicines that arrest her stress.
Okay.
I indicate medicines of overthinking. I attribute a little symptom and take it in my prescription. 100%.
Wow, that's nice. That's a completely different
Yeah.
angle. And also, when we talk about homeopathy, we often are concerned about its effectiveness as compared to allopathy. How effective is it in treating acute versus chronic diseases?
In fact, I just answered this question before.
Yeah.
But I think what makes homeopathy very, very different in terms of its chronic and acute treatment is the fact that it works. It works in both. So a cold cough case or a child who's suffering with any kind of cold bout or cough will of course be fine in about 4 days with good homeopathy medicines. 4 days is the maximum time. 2 days the child should be better in. That is how I work in homeopathy practice, because in cold cough, if you don't make a case better, it can often lead to pneumonia.
Yeah.
10 दिन से अगर आप केस नहीं ठीक कर पा रहे हो, छोटे बच्चे में pneumonia develop हो सकता है. Small cold cough, if not treated, can lead to pneumonia. So you need to make sure that the treatment is well enough. Now let's come down to chronic. Homeopathy, about 60 to 70% of our cases are chronic. Psoriasis, eczema, asthma, bronchitis, gut issues, IBS. All of these are chronic issues, and 60 to 70% are just chronic issues. However, 30 to 40% are also acute issues, and these acute issues are cold cough, diarrhea, vomiting. Yesterday, one of my patients had vomiting and stomach
Okay,
ache.
so for vomiting as well, you have...
Yeah, absolutely. Stomach infection. Homeopathy does give good results if you have the right medicine.
And how long it takes for those results?
In cold cough, less than 24 hours.
Okay.
In stomach issues, anxiety, it has to be fast. So I give the dose much faster. Sometimes it's hourly, the doses, and they act fast.
So it also helps in mental health conditions as well.
100%. Anxiety. So many patients are there of anxiety whose conditions only worsen because they have anxiety.
Okay.
I have a patient who's in Mumbai right now, and she has chronic bronchitis, chronic. And her case only worsens when she has anxiety because suddenly she can't breathe, right?
Yeah.
So she has bronchitis issues aggravated by stress and anxiety. So of course anxiety, and we have to give them medicines of anxiety and bronchitis together. Sleep issues are so common. Before rushing for a hormone for your sleep, think about using homeopathy. Think about it and then move ahead.
Yeah, I mean, people often do not consider homeopathy as the first step. They go into conventional medicine, allopathy, even for cough and cold, as you said. I'm quite surprised that within 24 hours we can get results for cough and cold. So that is very nice. For me, who doesn't like medicines, who doesn't like capsules, I would love to go for that. But similarly, are there any conditions where homeopathy is not recommended?
100%. Every science has its merits and demerits.
Yeah.
No science, no pathy in the world is complete. Yeah. We're all together complete. That's why our government made sure that they created a body like Ayush, where they advocated alternative medicine, holistic medicine in our country so beautifully across the globe today. And when we talk about the demerits of homeopathy, never take homeopathy when you're having a heart attack. You should rush to the hospital immediately. Don't rely on homeopathy for emergencies like these. You have a fracture, there's a severe fracture that's happened. Don't go to your homeopath with that fractured leg. Immediately go to the hospital, get rehabilitated. Check what the issue is. Check if you have fragments, you will 100% need rehabilitation and rest. Yes, after you've been treated in the acute stage, you can think about taking homeopathy to manage your lifestyle in terms of chronic issues, in terms of cholesterol. So if there's a case of heart attack, and why do people have heart attacks? One of the major causes is artery blockage, right? Why do arteries get blocked? Because of high cholesterol. Somebody can manage cholesterol very well with homeopathy if there's somebody who's had a heart attack before. After managing that myocardial infarction, that heart attack, you can think about coming to homeopathy for managing your cholesterol levels, for managing obesity, or managing your stress levels. Furthermore, when you come to us for fracture, we can 100% treat you. In terms of your treatment, your body regeneration, for you to have and develop that kind of strength that you had before your fracture. But in emergencies, rush to hospitals. Don't think about alternative medicine in emergencies. No.
And what are those conditions where homeopathy works the best?
Every case, yeah. Almost every case. Gastritis, your IBS, simple things like cold and cough, viral infections, bronchitis, asthma. So many of our patients are better. Anxiety. These are very common issues that can be 100% arrested.
And even also in pediatric patients?
Yeah, pediatric practice is one of the biggest areas of homeopaths today. And we can't deny that. Even things like skin issues like acne, pimples can 100% decrease. Menstrual disorders, periods not coming on time, simple things like that can be arrested with homeopathy.
And can pregnant women take the medicines?
Yeah, 100%. 100%. I have so many patients who are pregnant. 100%. It's completely safe under a doctor's guidance.
Now, one thing, Dr. Tanya, is about the medicine. Now, what you are taking, is this allopathy or homeopathy?
I just right now, I spoke in the interview with you. And because I was speaking a lot, I needed water, right?
Yeah.
Immediately, I told them, I don't need it. Just give me my throat aid from the bag. This is throat aid. This is homeopathy.
But I haven't had those kind of medicines.
In homeopathy.
And you can easily chew it. Okay. And I can also have it. I have nothing like that.
You are speaking, that's the only reason I'm giving it to you, because you are stressing your throat. So am I. I've been speaking for the last 2 hours. That's the only reason. So I'm giving you this.
I can chew it.
That's it. There's no taste.
Yeah, there's no taste.
And these are safe homeopathy medicines that have been clinically observed to give good results. Homeopathy medicines come in different forms. They come in tablets, drops, tinctures, pills, every form. This is the best way to take medicine.
And this is to...
this is to soothe the throat, because I've been speaking for the last 2 hours. That's why.
Okay. And
It's always there.
And you can take any 2 or 3 pills as much as you like?
I took 2 or 3 because I'm used to it.
Okay.
I'm used to speaking. But right now, because I'm stressing my throat a lot for the last 2 hours, I just take this much, I'll be fine.
Okay.
Anybody who has sore throat can use this. They'll be fine. Sore throat, itchiness, who are singers, people who get a sore throat very easily, khatta thanda kha liya.
Yeah.
100%.
Oh, that's nice.
Yeah. And it tastes good. You've
Yeah,
tried it.
yeah. It actually had no taste.
Yeah.
But for me, I hate tablets. So this was a very nice option. I mean, if I get, something like that, I'll be taking the name and all from you. Yeah. But also about the side effects, like you took 2 pills, 3 pills. When we take Dolo or something else, we have to remember in our mind that, there are going to be side effects from any medicine.
Nothing. No
What about
drowsiness, no sleepiness. I'll be absolutely fine. See, can you see the change in my voice?
Yeah, there is actually a change, yeah.
See, in minutes.
Yeah.
I'm your live example. Look at the strength in my voice. This was not there in the last 10 seconds.
Yeah, it wasn't there. So that's like change in minute. I could see the results in a minute. So
this is where the right homeopathy medicine can give you the right result in minutes.
Oh, that's nice. But also, talking about side effects, as I was saying, many people have this, thing in their mind that, there might be side effects. How is it that, there are no side effects in homeopathy? There must be something. Is it true or not?
There are no side effects in homeopathy, but if you take homeopathy for years and months without a proper vigilance of a doctor, or supervision, you will start getting medicinal proving, which is exactly what we tell patients, but these are very rare. These are people who've been taking it for years without any understanding, right? So we know as practitioners ke exactly kya galat ho raha hai, kya sahi ho raha hai. That is why in homeopathy also we give a break. You must have seen, you just told me about your story, right?
Yeah.
After 3 months, you don't need a medicine, you
Yeah.
need a break. If you have another bout, always come to your doctor. Always remember, किसी भी चीज़ की अति करोगे ना, अगर ज़्यादा करोगे, चाहे वो सोशल मीडिया भी क्यों ना हो, तो वो उल्टा पड़ती है. The same situation is with homeopathy medicines. चीज़ को लो, लिमिट में लो. Don't overdose it. Don't overdo it. Right? कोई भी अच्छी चीज़ भी अगर हम overdo करते हैं, वो बुरी बन जाती है.
Oh, okay. So that's a new thing that I learned. But also, when we talk about homeopathy and allopathy, can we take both of them
100%.
together?
100%.
Okay.
So we have so many cases around in our clinics of thyroid. Ab thyroid mein the patient is already coming to you taking an allopathy medicine. You can't say no, don't take it. The case will ultimately immediately stall and the patient will be like, look at my levels, what have you done? So we maintain it and we slowly decrease that kind of medicine.
Okay.
Similarly with diabetes, we decrease it slowly. Emergency medicines should not be cut off immediately. They should be cut off slowly, steadily, especially medicines like these which are for diabetes, which are for thyroid, but under a homeopathy practitioner. Right. You can't do this. So many people take medicines for headache and at the same point of time they're taking homeopathy for headache. It's fine.
Okay,
Absolutely
it's fine, it's fine.
Yeah.
There are no side effects or
there's
no
no
risks
problem
involved.
as such, but go and consult your doctor. You never know how much of what you're taking can cause an issue, right?
And also there's a term known as homeopathic aggravation.
Yeah.
What is that?
Homeopathy aggravation is a term that is very much present in our books. It states that homeopathy aggravation will be there and then the patient will recover. But in clinical practice, we don't see it. We don't see homeopathy aggravation happening in every case. Imagine there's a child who's coughing, who's highly asthmatic, wheezing, and I give them homeopathy medicine and there's homeopathy aggravation. Will that child come back to me?
No.
The child will be like, thank you very much. Parents will be like, thank you. My child is worse because of you.
Yeah.
Remember, we do not see homeopathy aggravation in every single case and provided you're given the right medicine by the right doctor. It is clinically very different. Very, very different. Not at all. Not at all.
And also coming to the medicine part, you know, when I was going through my consultation, I was told about making some changes in my lifestyle as well. You know, dietary is different thing, but lifestyle as well. I was asked not to have coffee.
Milk in particular.
Yeah, I was asked not to apply perfume as well. So I'm confused and also surprised why limitation on perfume when I'm taking a medicine? What could be the reason behind that?
You were taking a medicine for sinusitis.
Yeah.
So when you were taking a medicine for sinusitis, and I'm so happy and proud that you shared this, certain few strong smells can aggravate your sinus. That's why your doctor told you, please don't wear too much perfume or don't wear perfume because it'll aggravate your sinus. Anybody who has sinusitis, it'll aggravate your sinusitis, mind me. Sinusitis is inflammation in the sinuses. Your nose becomes very sensitive compared to those who don't have sinusitis. So these things trigger. They trigger your smells. किसी sinusitis के patient से पूछना अगर कहीं तड़का लग रहा होगा उनको सबसे पहले smell आती है.
Yeah, right.
You'll be one of those.
Yeah,
if you
I
have
am one of
sinusitis.
those. Yeah.
That's why your doctor told you don't wear too much perfume. It could trigger a sinusitis attack of sneezing. That's why. And second thing, why they told you not to have coffee. This it's a very, very debatable topic. Yeah. You were advised not to have coffee because of the milk, more importantly.
Okay, why so?
Milk in sinusitis is again contraindicated because milk is also something that has a tendency to produce phlegm. So milk is also something I prohibit from patients who have respiratory issues. Tell them please don't have dairy products. Have ghee. Ghee is still okay, but don't have a lot of dairy. Don't have milkshakes. People are very used to having banana milkshakes.
Yeah.
Strawberry milkshakes.
I love chocolate milkshakes and all.
Yeah. So there has to be a decrease in your milk consumption for your mucus to not be produced in the body. This in homeopathy we call as a maintaining cause. If you don't remove the maintaining cause, then phlegm still will come, right?
Yeah.
So that's why your doctor told you reduce coffee there also. But also because certain homeopaths say, okay, don't have pyaz, don't have this. But in my understanding, my personal opinion, right homeopathy medicine works With, without coffee, with, without onion,
So
with,
these are
without
like,
garlic.
even if we can follow, it's great. If not, then also it will
Yeah,
work.
yeah. In a normal lifestyle, nobody has the choice saying, "Acha, mujhe aaj garlic onion ka khana mat dena, mujhe aaj medicine khani hai." No, that's not possible. So you have to be practical in today's time also, right? You can't be impractical and impose too much. If you impose, then science becomes shorter because it can't be consumed by everybody then.
Yeah, exactly. Now, Dr. Tanya, moving on to another segment where we have, I'll say a statement,
Right.
and you'll have to, differentiate if it is a myth or a fact. Okay?
Right.
So I'll just give a statement. First of all, people believe that homeopathy is just a placebo.
False.
Completely false. There's a particular
Completely
science
false.
behind it. Yeah.
Absolutely false.
Homeopathic medicines, remedies are just sugar pills.
Completely false again, because sugar pills are a vehicle for me to give you the medicine. In my bag right now, I also have sugar pills I can show you. It's a vehicle where I put my drops in them.
Yeah.
It's just a vehicle. It's not mere sugar pills. You can have homeopathy medicine in the form of tablets also, in the form of dilutions also, mother tinctures also. The variety is there.
There's a huge variety.
Yeah.
Yeah. All homeopathic remedies are safe for everyone.
All homeopathy remedies are mostly safe for everyone,
Okay.
if indicated and used in the right manner. Now, you can't expect somebody overdosing on a mother tincture and the person to be absolutely fine. No. There's a limit. There's a proper way you treat a science and a medicine.
Just like in allopathy as well.
Absolutely. You wouldn't take any tincture in any other pathy and just down it, right? So, you have to have everything in the right logistical manner. That.
Homeopathy cannot be used with other conventional treatments.
Homeopathy can definitely be used by with other conventional treatments. We have so many patients who are recovering from other treatments and we give them medicines. It's absolutely fine.
So it's fine, yeah.
Yeah.
So we actually busted a lot of myths that
Yeah.
people had in their minds. But what we can see is that I got to know a lot about homeopathy. I was confused why I couldn't apply perfume, but now I have the answer. So for our viewers, even if you choose allopathy or homeopathy, you must be, well informed. And I guess this interview helped you. And thank you, Dr. Tanya, for
Thank you.
clearing all the facts, for busting all the myths, and for informing us with all the legit information that we need to move ahead. And for our viewers, if you like this conversation, then do share, like, and drop your comments. And for more such updates, stay tuned with India TV.